Buy my novel, Escape from the Village, from major booksellers online. Go to escapevillage.com. Subscribe to my Substack. Go to fountainheadforum.substack.com. Thank you. Welcome to the party, pal. This is Fountainhead Forum 165. I'm talking with Charles Ballay, who is running for president, the nomination in the Libertarian Party in the USA. He's also a doctor living in New Orleans. How are you, Charles?
Fantastic, Chris. Thanks for having me on. I appreciate it.
Yeah, thanks for coming on. Yeah, you're sounding great. Anyway, how did you get into libertarianism?
So basically, my entire life, I've always identified as an independent until about the early part of last summer, when I don't know what it was I was perusing, but basically there was a article, and it's like, wait a minute, this is sort of the values of which I believe in. And at the same time, you could say, I'm a bit disgruntled with the two-party system. I've been this way for quite some time, many years. And as the current two-party system does not seem to be taking care of the common person, then I've decided, you know what, this is something that I'm going to really try to pursue. It came about just sort of serendipitously, so to speak. I can't say that I've never really thought of consider myself so much of as a politician. I've always worked as a physician, but over the growing the growing disdain that I've seen over the past, say, 14, 15 years, I guess it compelled me to go forward and just to try to see if we as a party can actually help this country. So to answer your question directly, it was probably early part of last summer. But at the same time, I've probably been carrying these values for me. I can't think when I have not, is, I guess, best way to put it, right?
Yeah. I'm wondering, is Louisiana politics different from the rest of the country, or because I know, being their civil law instead of common law and things like that,
right?
Initially settled by the French.
From a political,
is New Orleans politics different from Louisiana politics?
Yes, and everything you just said, yes, check mark, right? Louisiana, New Orleans is its own place. Louisiana is different from New Orleans, so to speak. Yes, but politics is pretty can be very let's just say it's just part of our society, probably more so than many other places. It is a rough and tumble state when it comes to politics, but at the same time, if you look at ballot access laws, it's completely fair, right? So it's sort of a weird dichotomy between the two.
Oh, that's good to know. And of course, one statistic I believe is I believe Louisiana is actually the most incarcerated state per capita.
Yes, no, that is true. Some of the most gun violence. I mean, you have to look at it for what it is. This is a very poor state compared to many others, right? There's not a whole lot of industry compared to many other states. Consequently, you don't have a lot of persons that have jobs that they can't take themselves out of a poverty state or even sort of a lower middle class state as a consequence of the lack of industry here. I believe you're in Texas. I mean, we have nowhere near the industry that you guys have. I mean, we have shipping and we have tourism, right? We have seafood, sure. We have oil and gas, or what we used to have, oil and gas. That's really kind of fallen by the wayside, right? And so consequent to the lack of industry, there's probably a bit, the state is a bit more wanting when it comes to education, when it comes to jobs, when it comes to many measures of quality of life across the United States.
Yeah. In New Orleans, we've thought of a few crises there. I'm just curious, how did Hurricane Katrina and the aftermath affect your politics?
So when Katrina hit, I was actually in Houston. I was working at Ben Taub at the county hospital in Houston, Texas. So we had they moved a lot of persons, refugees, evacuees. Everybody had different names for who persons were living in the Astrodome at the time. And so Did it affect my politics? In some way, it did. When you saw persons from, say, the inner city of New Orleans leave, many of the children had an opportunity. When you saw them break outside of their few block area and move, say, to Texas, whether it's Houston, the Hill Country, up north somewhere, in other states, etc., you saw some of these kids really flourish. I mean, and I got to know some of these people even after I left Houston. I mean, some of the people that when I left Houston, went to California for more training and had a practice in the Hill Country in Texas, out in Kerrville for a while. And there were actually a number of people that had moved to Kerrville from New Orleans after Katrina. And those kids were doing fantastic. I mean, and I think if those same persons had stayed in New Orleans, they would probably have not fared as well as they had, right? So you saw destruction, but New Orleans is an extremely resilient city. I mean, the people here are fantastic. They do not give up, despite hurricane after hurricane, and despite being obviously below sea level. This is not a city that just sort of lays down and says, "Woe is me." It tries to fight back, and so in many ways, Katrina probably improved the city from a perspective of galvanizing the people who remained here, right? Uh, uh, but what I saw, at the time was persons who were evacuated over to Houston, and we saw, I mean, a lot of these persons needed healthcare, so that was my perspective, right?
Yeah, well, also you go from New Orleans to Houston, you're going to an even larger city. But if you go to Kerrville, Texas, you're going to a much smaller city. I don't know if that was the difference, or there could be a lot of differences. It's funny, but it is interesting because sometimes a move like that, you do kind of you lose all your bad memories go away, and it can be a positive change, no doubt about it. And
I mean,
certainly the population.
my perspective on education is, you only get a fraction of your education for being in a classroom. I mean, we all know that education or being genius is 99% effort and 1% smarts for the most part. And these kids, their education that they had from seeing other places and meeting other people and seeing another culture, was truly an education, as opposed to sitting in a classroom where one may or may not receive any real guidance, particularly in the inner cities in New Orleans, right? So I think the education itself was moving and seeing and realizing that the world's bigger than just your four walls that you have back in this city. So yes, it was a tragic event and it was horrible, and hopefully it never happens again. And we've sort of, we've built structures in order to try to mitigate some of the problems, should it happen again. But New Orleans is always going to have problems like that, just by location, right? Just as Houston has the same thing, Galveston has the same thing, Mobile will
Yeah,
have the same thing, right? Um, you know, um, yeah, but when it comes to education, I firmly believe that seeing other people, learning other cultures, being immersed in other ideologies actually is far better than, in many cases, sometimes reading in math and science and arithmetic and that sort of stuff.
you know, how? Yeah, yeah. So how did New Orleans end up being below sea level and below the river? That seems rather strange. It seems like
Oh,
it's geographically impossible.
yeah, well, the French Quarter is actually, up on that ridge. It's the higher point, but I mean, it's just it was an area chosen many decades ago, and unfortunately, it has a lot. The ground is not very hard. It's not like where you guys are with
Yeah,
limestone and and a lot of dirt. You're dealing with just wetlands. I mean, it's like
yeah,
uh, you're in a swamp. So I mean, consequently, there's always subsidence. That's why our roads are so horrendous. I mean, there's potholes everywhere, and it's always going to be that way because you just sink. That's what happens. And you build a
ground's
house, you have
always
to,
shifting. Yeah,
yeah. I mean, you have to put
and
pylons and
and,
sure it up, right?
and you can't really build any tall buildings, I suppose, too.
I mean, they have downtown, sure, but they have to sure it up. I mean, it's a I wouldn't know much about that, but they do. I mean, it's a, city's the city,
Well, New Orleans got started. Obviously, it got started as a port, but
right?
it evolved from there. It's being on, as well. the mother of all rivers. At least that's what the word Mississippi means. And, it's
Right.
it's got to be pretty amazing. You get all these big boats in. I'm sure you get some amazing boats there, and really getting, a port that was from all around the world. But as a result, too, you got a lot of different influences there. You got the French influence, some
Spanish
Spanish
influence.
influence, and now some American English influence. Yeah, it also developed one of the more unique cuisines in the world. I mean, we can't talk about New Orleans without talking about food.
That's right.
Yeah, I never had jambalaya before I moved down to Texas.
Well, you have to come to New Orleans to get some real jambalaya.
I'm sure you'd say that. Yeah, yeah. I need, that's someplace I need to visit just for the heck of it. Just to see what it's like and visit pay tributes to Louis Armstrong. I know.
That's right.
Louis and Fats Domino. I mean, they're both gods in that town, right? I mean,
Right.
Yeah.
Just make sure you do it so in the spring or in the fall, because if you try to come during the summer, you're going to curse yourself because of the heat, right?
I can imagine. Yeah.
Yeah. And it's hotter than Texas heat. Having lived in both places, because it's a very humid heat, right? So you'll find yourself miserable. So spring or fall.
Yeah, it's more humid, I'm sure. Yeah. So maybe have some alligators. So anyway, so you were also, and you're a doctor, and New Orleans did become one of the early hotspots in February of 2020. Can you tell us what happened then?
Oh, sure. I mean, so it was around Mardi Gras, although, perhaps it was slightly prior to Mardi Gras, just, having spoken to people who were symptomatic, or having respiratory illnesses that didn't sort of align with the flu or the usual. So we had a pretty big wave come in early on, and consequent, there were a lot, and this, New Orleans is call it unhealthy. Everyone likes to eat and drink, not a lot of exercise, right? It's not, and there's a lot of medical comorbidities. So consequently, we were hit early on. And it was pretty much a wave. I mean, yes, there were a lot of people that passed away as a consequence of whether it's COVID or whether or not it's, consequence of respiratory illness that exacerbated what medical comorbidities patients had. So it was really a hotbed right then. And and unfortunately, with it being so early on, there was a lack of guidance, a lack of supplies, a lack of a lot. And it was sort of a miserable time around here, as it was in many places in this country. But hopefully, we'll never go back to anything like that again. It was all that and more. When it hit, and then slowly, things improved over time, and we became a little bit more understanding of what was, what the virus was and how it was affecting people and such. But yeah, it was not a good time. I mean, so I worked through the whole thing. My job, in addition to usual ENT stuff, because people still get sick regardless, is dealing with airway problems with COVID. And so we'd have to operate through that. So so I have my gas mask somewhere around here, and it's right over there. I'm gonna go pull it out. I'm gonna bring this to you, and I'm gonna show you this. So we strap this on, right? Have my gas mask. Let's still have this damn thing in case we need it, I guess. But you'd have a gas mask, this thing, and you just wear your respirator, right? And put it on and go do what you're asked to do, right?
Those ones are probably effective. Yes.
Yeah. So well, I mean, first you had N95s, but then once we started, we were able to get our respirators. You'd wear these things. But it was a trying time for everyone. I mean, as it was in the rest of the country too. I mean, let's not forget what happened everywhere else. But it changed medicine forever. We had, you had doctors not fare so well. You had doctors get sick. You had people succumb to the psychiatric side of things when you're seeing that many people pass away or get hurt. You had a paradigm shift in nursing. Nurses became travelers in many cases, so there'd be hot spots around the country, and so nurses would have to, or not have to, they would choose to move where they could earn more in various parts of the country, and consequently you'd have shortages at hospitals where you couldn't afford it, you didn't have the need, etc. Right? Same holds true for allied health professional, ultrasound techs, X-ray techs, you name it. Right? So I mean, it really kind of changed medicine forever. And some of that's coming back, and some of that may never come back the way it once was. Right?
Yeah. I don't know how it works with nurses, but it looks like it also opened up some reciprocity with doctor licensing, or
yeah, it did. So I think,
the doctor who's licensed in Mississippi can't go to
right,
can't go to New Orleans, or the doctor who's
right,
licensed in Louisiana can't go to Mississippi.
right. And that's a huge coup. I mean, so I think when I last looked, there were 36 states that would participate. Uh, and the nurses all have, it's a nursing compact license too. There are also some reciprocity, which is a huge coup. I mean, that should have happened a long time ago. It shouldn't have taken a pandemic to push this. I mean, living in Texas, go down to the Valley and try to go find a bunch of doctors. Good luck. You can't, right? At the same time, if one could easily use their license to go to and from, you might find that you'd have more health professionals working in areas where the need is present, right? As opposed to staying in the large cities, people have to travel, etc. Right? When I was down in Texas, I mean, we'd see a tremendous number of persons that would come up from the valley because they just didn't have the health support, right? Some of that was financial. I mean, you couldn't move out to way south of Fredericksburg or Kerrville out in the valley because you just wouldn't have the patient population, so they would come to you. But there was also, in Texas at the time, there was a lack of physicians that had occurred secondary to issues with malpractice, which the laws then changed. So there was med-mal cap, and then they began attracting persons back to Texas, right? So, but to answer your question directly, that licensure issue now allowing physicians, nurse practitioners, PAs, nurses, in the whole list between states is really a good thing. I mean, it should be embraced.
PAs?
I'm sorry?
What are PAs?
Physician assistants.
Okay.
And varying in the states, they may or may not have more. What he or she is allowed to do varies by state, so to speak. Some places they can actually help with procedures, some places they can't. It depends on the scope. The scope of their practice is generally is a state issue, but it also sometimes has to do with who he or she works under as well, right?
What would we say if we just got rid of all the licensing altogether, Charles?
Not have physician's license?
Yeah.
That would probably be a little dangerous, I would think, in the sense that you want to know, so I would implore you to go say, hey, look, doc, I need to go have a procedure. I need my gallbladder out, right? Go try to find outcomes, right? Just try it. Good luck. Find a procedure, any procedure, right? Look up a doctor and look at outcomes. You can't, right? You can't find it anywhere. I mean, I know this. I had suffered with cancer in the past, and prior to undergoing surgery, I was saying, all right, what is this what is this particular doctor's outcomes with regard to this procedure? And that's a hard item to find for many reasons, right? Different patient populations, medical comorbidities, you go on and on and on, but you can't, right? So yes, you can find physicians, you may be able to go sign up, but how would you know that he or she is actually vetted and can actually do what they purport to do? I'll give you for instance.
Yeah.
When I was in Houston, right, we would see persons come in from across the border that would have, in many cases, is plastic surgery procedures. They'd have like silicone injected into their butt, etc. Right? They'd come in with just horrible infections, or they'd come in with horrible sort of autoimmune-like diseases, etc. That in many cases, they had to. I mean, it was not a good thing. Now, whether or not these particular individuals knew what they were getting into and took a chance, or if they were tricked into doing this, who's to say, right? I don't know. But the way persons are vetted in this country in order to make sure that this is you're going to have a safe society, I think is more than reasonable. mean, so for me to do what I do, not only do you have to go through medical school, but you have to go through, I don't know, I think 5 years ENT now, and then I did another year of ear stuff. So you've done these procedures and done these procedures and done these procedures and done these procedures to the point where you can do these things. And there's always going to be some hiccup. Something's always going to be different. You're always going to learn from everybody you operate on. But you've done these things so many times that you would be considered safer than someone who has just said, "Hey, look, I'm going to try this," right?
Well, some professions don't have licenses, but they do have certifications, and certainly, doctors will put their degrees up on the wall. So
Right.
even if a doctor doesn't, doctor has Harvard medical degree, or doctor
Yeah.
has Johns Hopkins medical degree, or
Right.
I mean, I don't know if that makes a difference, but there's lots of other things, and not to mention, just word of mouth. I don't think anybody in a business is necessarily, most people who who provide a service want to provide a good service because they know that providing bad service will lose customers and trash their reputations. Yeah. So
Yeah, but that's the thing, though. You can't find outcomes measures for physicians. It's very difficult, right? So
yeah,
they try. I mean, hospitals gather data, right? And you know this data is available, right? Because we have to input things into a computer system now, of which is monitored by hospital systems, of which is monitored by insurance carriers, right? So if there's a problem with something, there's going to have to be generally a recourse that in order to pay, right? So if you have a say a gallbladder that comes out and you then become septic, you're going to be in ICU, etc. And so if you look at this data, you should be able to find this data is accrued somewhere, right? So some of this data should be available to see, but you can't find it, right? It's not there. So yeah, you can have all this. I mean, my wall has a it looks like a giant wall of degrees, right? But it doesn't say that there. It doesn't necessarily mean anything about my outcomes. Um,
yeah.
so you have to be careful about that, right? But so consequent to go back to your question, when it comes down to licensure, you have to prove not only to yourself and to your peers when it comes down to your residency program, but you also have to prove to state organization, etc., that you are a competent, capable individual that is safe for society, so to speak, right? Um,
Okay. So yeah. So yeah. So but do you think we have a short? I've heard we have a shortage of nurses. Do you think we also have a shortage of doctors, and maybe this was part of the issue?
well, yeah, but I don't think that's not necessarily part of the issue. Part of the issue when it comes to the physicians is many-fold. Number one, you only have so many residency spaces on an annual basis for any particular specialty, right? Training spots, right? And that is uh, a governing board up higher, and they determine how many slots, etc. Uh, the same holds true for nursing. I mean, you only have so many slots for nurses, right? If you look at it, also there's a different shift, and I'm a firm believer everyone's equal. You don't judge anybody by race, color, creed, etc. But look at it right now. You have a 60%. Last I had read, it was like 60% of your medical school class are female. Females are going to want to have families. Okay, and as a consequence of that, you're going to have your labor force is diminished, right? Because if I need to take off for whether it be a month, 2 months, 3 months, 4 months for a child, you're not going to have that particular person in the workforce, right? So it's also changed based upon who is becoming a physician, and that's wonderful. Look, I mean, but it also creates some degree of need, right? So you're correct in that regards. The fact that you have organizations that say mandate these are the number of slots that you will have that are needed, that creates in a way a sort of a in some cases, depending on the specialty, right? It creates a need, right? You're right. Having said that, how would you fix that? You'd probably have to open more slots, but you'd also have to find competent persons to be able to work in those slots. Um, I'll give you, for instance, if you want to become a physician and you go through med school, if you want to become a family physician or internal medicine doctor, you can find slots all over the country. In fact, there are so many slots that we have to bring people in from foreign countries because we don't have enough people to fill those slots, right? Um, It's a matter of not only having slots, but you also have to attract capable individuals that want to participate in that particular activity, right? There are many disciplines in medicine that people don't want to go into because it's just not as fun, so to speak, right? Uh, um, and, and and so that in itself is also another issue. I mean, if you say, well, there's not enough slots, well, that's not entirely true. There's not enough slots in certain industries in medicine, but if you want to become a family doc or an internal medicine doc, you can find slots in many cases across this country, and we don't have enough people to fill those slots.
Yeah, that's lots. So yeah, yeah, we have people, of course, those countries probably need doctors as well. Yeah, well, one thing I got asked too is, does Louisiana have I don't, Texas doesn't, but does Louisiana have certificate of need laws?
I don't know. I'm not exactly sure what it is to which you're referring. I mean,
Basically, if you want to open up a new hospital, you have to get permission from the other hospitals to open up a hospital.
I don't know. I've actually never inquired as to with regards to that. I would imagine that they, in some way, shape, or form, because you have small communities that that are going to have some means to triage people in an acute situation. And I don't know. I'm sure the governing board in the state and maybe even to the federal level, I would imagine to the federal level, has to okay that. I mean, we'll have hospital services, so to speak, not hospitals. And, like for instance, down from where I am, about 60, 70 miles south of here, there's a beautiful structure courtesy of the federal government that was built post Katrina. They have emergency room services. They don't have enough persons to man it, to have a hospital per se. Nor would you want to have a hospital right there if you can put somebody in an ambulance and bring them straight up, because you would imagine the services that you're going to receive in a small place if you don't have persons to work around the clock to actually stay up to date with their skills, right? That's not that wouldn't be actually a place that you'd probably get wonderful care if you were needing, say, an ICU bed or something like that, right? For the routine sort of scrapes and bumps and cuts and infections and sinus stuff, etc., it's fine. But for serious stuff, yeah, of course you wouldn't do that.
Yeah, I think one thing that, what do you think about, prescriptions and scheduling of drugs? I think if we had I think if we deregulated drugs, we'd probably have more and more people just going straight to pharmacists instead of
Some,
going to the doctor, if they.
it depends on the medication, right? So some, and I'll kind of give you a few examples. The When it comes to like, first of all, when it comes to like medicines, when it comes to like drugs, narcotics, etc., like that, uh, let's go back to the libertarian thing. I think this whole war on drugs is a failure, and in many cases, it actually affects me adversely because I'll want to use certain medications, drugs, for surgical endeavors, and I can't because of the scheduled basis, the laws that have compelled the pharmacists uh, to regulate these drugs so carefully, and consequently the cost is up, etc. It makes it impossible for me to use. Okay. Um, at the same time, I'll see persons that sort of self-medicate themselves for whatever it may be, a cold and what have you, and they're not going to hurt. They don't hurt themselves, but they they don't achieve the result that they're trying to find, right? But the other thing is that you may miss, is that as soon as a drug becomes over the counter, okay, and it's not requiring a prescription per se, most insurance carriers drop the medication off of their rolls, right? So you'll have persons that come in to see me that want a drug that is readily over the counter, but because they don't have the money to buy this medication, they want me to prescribe this medication. And in some cases, they actually cannot get this medication because insurance won't afford them this medication because it is now over the counter, and consequently, they don't have the cash to buy it, right? That happens a lot, believe it or not. And it's simple. You'd say, hey, look, why don't you have 20, 30 bucks to buy this? They don't, right? But it's over the counter now. And so guess what? You can't have it, right? It gets complicated. Do things need to be less regulated? Probably so, depending on what it is. I mean, you wouldn't want to go down to the street and say, I think I have CHF today. Let me go take a whole bag of Lasix and see what happens to me. Good luck. You'll find yourself in the hospital probably after your pressure bottoms out, right? Or you kill your kidneys or whatever it may do. It depends on the drug and the side effects associated with those medications and how much could you hurt yourself should you not understand what it is that you're taking.
Well, I can bring up a case in point. I got what we in Austin we call cedar fever, which is basically allergies from cedar pollen.
Oh, I'm well acquainted with it.
And I went to a doctor and got a prescription that did a pretty good job with it. A few years later, I went back to the same doctor, and she gave me a prescription for something else that didn't work.
Right.
And then I looked it up and I found out that the patent had expired on that drug. And I was like, why didn't you just give me? And now sometimes if I go back to the doctor, I just take the bottle of the prescription that worked. And I say, hey, here's what worked last time.
Yeah. That happens very frequently.
Because I know I mean, I'm not a doctor, but I know my history. Right. I know, pill A worked, but pill B didn't work. So,
right.
It's, and sometimes, doctors will say, okay, that's cool. That makes, if you tell them what worked the last time, it's, but, yeah. So, yeah, I mean, yeah, there's always a danger that people are going to do something stupid, but I don't know if we can make stupidity impossible. It's, you can give somebody a prescription and they'll take, you may know the joke, about the guy who was, given suppositories, but he just took them like pills.
Oh no, that people do that.
And then he went back to the doctor. He said, these didn't work. I might as well have just stuck them on my ass.
That's funny, but I've seen it.
Or what's the other joke? The guy gets condoms and it says place on organ. And then he says, well, I didn't have an organ, but I had a piano. So I put it on the, I didn't have an organ.
That's funny.
Yeah. So, yeah. Anyway, so what happened? It sounds like New Orleans was kind of a hot spot, almost the level of New York. What did you think of some of the policies that were implemented during all this?
So when it first happened, we would sort of have a rolling figure carried out by one of the departments. It was like one of the government's aides would kind of give this through the Department of Health. And what you had was a list of number of patients in the hospitals. Normally you'd have a list of persons that were in the emergency room waiting for beds. You would have number of ICU beds available, and you would have ventilators available, right? And so you'd have a peak, or where that peak was, so to speak. Now, I'm an ENT. I'm not a hospital administrator, nor am I the chief medical officer. So call me a worker bee, right? But what you see when you're looking, and it becomes relevant because we're all in this situation together. What you see is the persons who are in charge are trying to mitigate the number of persons that are going to need, well, they're trying to basically save enough vents so that we have them, right? Because when this first went down, we were trying to figure out like how many people could we put on a vent, because you couldn't just get vents. You couldn't just call and say, look, I need 20 more. They didn't have them. The country was looking for them, right? And same holds true for a lot of supplies, N95 masks, Tyvek suits, you name it, right? So no one knew kind of what was happening, and you didn't have the supplies that you did a year into it. And so initially the whole goal, as it was sort of explained, is we want to try to provide the means to take care of people when these people come in, right? So they were trying to shift this, and consequently, they caused, everyone knows this, lockdowns, etc. Now, what happened was, initially I could see that this was a very valiant attempt to try to save people's lives because people were dying. I mean, if there's any question about that, I could look out my window and remember where they had the 18-wheeler, freezer trucks where they were putting bodies in it. I mean, that's not, I mean, they weren't using the morgue. The morgue was filled. And that's unfortunate. And it did happen. You'd see healthy people come in stroked out or what have you, right? Not that healthy people don't stroke out on a daily basis, but it seemed to be a hell of a lot more frequent back in those days. After time, though, as the virulence either decreased or the patient, rolled through the patient population, developed antibodies, what have you, unfortunately, those lockdowns persisted. So, do I like the fact that we were locked down and our New Orleans culture was, for the most part, destroyed, or was there? It was an attempt at destroying it? No. It went on for a bit too long. But the initial idea of this was to try to save lives, right? And I get the whole libertarian stance of we can't have this. I can just tell you, and I got in trouble in Pennsylvania for this when we did a talk. When you see that many people succumb to an illness or the consequences of comorbidities associated with an illness, it really kind of makes you understand that that was a bad time, right? Do I believe in government lockdowns? No, I don't. Do I believe in government telling you what to do with your body? Of course not. I think most people have common sense, but I can understand when this stuff first happened. You didn't know, no one knew what was going to happen. We were one of the first places that it hit. So you didn't know if everybody was going to get wiped out. You didn't know if this was something that was going to pass in 3 weeks. You didn't know if this was something that was going to, change society forever as a consequence of, death after death after death, or any other sort of other medical ailment that is going to be as a consequence of contracting this disease. No one knew, right? And so it was sort of like flying blindly. The government had no real idea what was hitting them. Nothing was coming out of China as to this is exactly what happened, right? So you're flying blind, just knowing that there's going to be a respiratory ailment, highly communicable, that, by the way, came into your town when we just had an event of 1 million people came through. So you kind of didn't know what was up, what was going to happen. Hopefully we never see it again, and hopefully something like this we never have to impose such an infringement upon our freedoms in this country, right? I just hope we never see it.
Would you agree, though, that in many respects, the other impacts of some of the policies actually were
people absolutely look,
probably lost more life due to this? I mean, I know kids. I know parents of kids who committed suicide during all this.
Well, absolutely. I mean, look at suicide. Look at how many people got hurt with regard. Yeah, I mean, so think of it from another perspective. We were saying, okay, the kids can stay home, right? They can use their iPads to study. They can use their computers to study. Well, unfortunately, my patient population, not every kid has that, right? They don't have necessarily an iPad. They don't have a computer. They don't have a house that is. They don't have parents that are going to say, all right, you need to sit down for your 4 or 5 hours a day and actually study. They don't have that. They don't have the guidance, right? Sometimes they don't even have the meals. I mean, they go to school so they can get a solid square meal for the day. And so this was sort of like to say, hey, you need to stay home is kind of like rich man's way of saying, you have the luxuries to afford your children something like this. The whole, I mean, I would agree. I mean, this, kids were pushed back quite a bit. I mean, families were destroyed as a consequence of this. That's why I say it's horrible. It doesn't need to, none of this should happen. We need to, embrace the fact that we're vulnerable and we're human. So we need to take measures and steps so that we can actually try to mitigate risk without having to impose such infringement on civil liberties to people, so that you don't have this sort of stuff happen again. We were caught completely unprepared.
Well, not the first thing I thought of was, what are these people in Alcoholics Anonymous going to do without their AA meetings?
Exactly. I mean, there's so many parts of society that it affected adversely. Absolutely. I mean, we worked through it. I mean, consider that a blessing, because I mean, I got a paycheck, right? for what it's worth, many people didn't have that luxury, right? They were basically just, all right, you're off, and it's like, all right, what do you do? I mean, you know, it's easy for me to say, oh, we worked through it, and that's, all right, well, all right, wow, you're, valiant for working through this and seeing sick people, but at the same time, you had a job, and you were around other people, you had socialization, you weren't trapped in four walls, wondering what's outside, right? I mean, I was able to talk to people and see people and treat people just as I am tomorrow, or today, earlier today when I was walking around the hospital. I mean, so we had that luxury, if you want to call it a luxury.
Charles, and one thing is, people didn't talk enough about the health issue. I mean, let's take two cities here. In Tokyo, there were 3,564 deaths. In New York City, there were 38,795. Now, Japan is one of the healthiest countries in the world. Why was nobody talking about this? That America has become a very unhealthy country. In fact,
of course,
American life expectancy has been going down since 2014.
Yes, that you're right. I mean, look at it. Lack of exercise, lack of proper diet. I mean, we're eating, highly saturated foods. There's a if you go down to, down the corner, you're going to find a fast food station on every corner as opposed to eating healthy. I mean, you have the same problem up in Austin and Texas. I mean, it's across this country. I mean, we have become an unhealthy society that uses pills and sometimes other means to try to promote health as opposed to actually living the way we should. Absolutely. I mean, I have to preach, believe it or not, even in 2024, I have to ask people not to smoke so much. It's like, really? I mean, come on. How much information do you need? And it's their prerogative to smoke or not smoke. But it's like, my God, how many family members do you need to see pass away as a consequence of cancer or the consequences of COPD carrying around an oxygen tank? How much data do you need in order to stop this sort of stuff? But again, that's someone's prerogative. It's a free society, or at least we purport it to be. And so that's their right, right? I may not necessarily agree with it, but who am I to say don't? I mean, as a physician, I do, because that's my job. But unfortunately, we live in an unhealthy manner, or many people do.
What do you, you still are. What do you think? What do you think? What other things do you think need to be changed in the healthcare industry?
So, if I were given the opportunity to do this, you would fix many things. Number one, you hit on something earlier, licensure, right? I think licensure needs to be a very simple means to transport across state lines. I think you also, at the same time, need to deal with the malpractice laws, right? So in many cases, the United States, physicians are ordering tests simply to CYA, right?
Yes.
I mean, so you come in and you have, I have this pain that's been in my neck for, whatever it is, for 3 months. Well, all right, we don't see anything. Your exam's fine. I keep an ultrasound here. I could look at it. I'm like, all right, well, all right, just wave it over you. You don't really see anything. You're not a smoker. You're otherwise a healthy person. Let's just say, for instance, right? I don't see anything. But in many cases, you're ordering a test, such as a CT or MR or whatever you are. In some cases, it's, you're looking, you kind of know what you're looking for. But in some cases, it's a CYA. And you're doing that because if someone were to walk down the street and 2 weeks somebody else finds something, then you're probably going to meet, or you have the potential to meet with malpractice, physician, because so-and-so found it, you didn't. Mind you that the disease process may not be aggressive enough to actually change anything should you wait 2 weeks, 4 weeks, 6 weeks, 8 weeks, or what have you, right? So in that way, cost or expenditures go up, right? So licensure, malpractice. The other thing is you need to make medicine fun again, right? Physicians get burned out with all these damn regulations. You have a governing body that creates an RVU system, relative value unit, which is a system created back in the 90s. Forgot which congressperson actually introduced this, right? It's a means by which that you can capture how much time someone is spending based upon the degree of difficulty and pay, right? So you have an artificially created payment system, right? Um, and many physicians hate it because instead of being able to spend half an hour with you or whatever it may be for your ailment, you're now on a clock. You only have so much time to spend. In many cases, you can't promote the health that you want to promote as a physician because you have to go faster than you would normally do if you wanted to sit down and really talk through it. Because look, you may get everything I'm telling you in 5 minutes, but someone who doesn't have the cognitive ability, you may need to explain it and explain it and explain it, and or call a family member and explain it to them, or do whatever you may need to do, and you just don't have that time anymore, right? Because of the way medicine works, you have whatever X number of slots, X number of patients, and this is what, because people have the misunderstanding that a physician, that you come in and they're making this gazillion dollars, but the truth is, if you really look at your copays and stuff, you have a billable and you have an allowable, right? I could bill you for coming to see me $1 million, but your allowable is going to be about $30, right? So in order to keep your office running, you have to bill X number of slots per day just to keep the lights on, so to speak. I mean, I know this because I ran my own practice in Texas, and you had to do this in order to achieve this. Otherwise, you'd go back to the bank and say, "Hey, look, I need a float for until I can kind of catch back up." And that was a continual thing when you're working, particularly in Kerrville, Texas, when you have a Medicaid or Medicaid, excuse me, is Medicare community, not so much Medicaid, although most of the kids were all Medicaid, both government insurance programs, right? So you have to make it fun again. You need to change this RVU system. You need to make it so that you don't have mounds of paperwork. If you ask for one of your doctor's notes, you're going to see 20 pages of garbage, and with maybe one line that actually means something, right? And a lot of these things these notes are padded so that you have to do this in order to achieve payment, right? So you might see that you have a note that's 5 pages long. The only thing that really matters is 1 or 2 lines, right? You shouldn't have all of this paperwork. And then the other thing is why is there no transparency in medicine, right? Why is it that if you go to clinic A and you go to clinic B, your cost associated with what particular test may be highly variable? And I get it. They may negotiate rates for one, knowing that they'll do the other, and they play catch up. Let's talk hospitals. But there needs to be more transparency. If you come to see me for, say, an external ear infection, I may see you get a whatever, a level 2 visit, level 3 visit, whatever it may be. Then you go downstairs, and the ear drops that we prescribe, if you were to pay cash, maybe $250, but if you were to go down the street, it may be $60 or $40 or whatever the heck it is, right? And you wouldn't know that unless you go inquire, and in many cases you don't know unless someone runs it through your insurance and then tells you what your copay is going to be, right? So there needs to be more transparency, right? You need to stop collusion. The market should not be so that various organizations can align and say, we're going to run this price up, right? And then also it goes back to the whole patents, right? So yes, a company needs to be compensated if they create a wonderful medication that helps society, but for how long? And at what point do you say the benefit to society exceeds that from what someone's going to be making on a patent? And so this needs to be changed. And so there's so many rules and means by which that need to be affected to help the consumer. I mean, don't you think it's crazy that for years that Medicare was not able to negotiate drug rates? I mean, it's crazy. I mean,
well, as a consumer, I think the craziest thing about healthcare nowadays is the lack of price transparency.
Absolutely. I mean, I work in this industry and I can't tell anybody what it's going to cost on any given day.
And there doesn't even seem to be an understanding as to why that's a problem. Charles, one thing else too is I've long been an advocate. I don't know how this, I think this probably would help malpractice insurance, as if we just implemented a loser pays system, which is something that a lot of other English speaking common law countries have. If I file some crazy lawsuit and I lose, I end up having to pay the other side's legal fees.
Yeah, or why could you not make it like a car, right? If I go to Hertz and I rent a car, I have to choose whether or not I want to buy the damage insurance premium.
Yeah.
Why would you not do this as a consumer and say, what, I'd like to buy the insurance, and by the way, I'd like to buy the what if something happens.
Yeah. And this is another thing that I think that is a problem with health insurance in general. Health insurance insurance of any kind is intended to be coverage for a catastrophic expense.
Yes.
I mean, an expense that, I mean, let's say maybe an expense that's like 3 months of your paychecks.
Right.
My oil changes are not covered in my car insurance.
Right.
That's not a catastrophic expense.
Right.
We have this system in healthcare where things like this are covered, and it's kind of silly, really. I mean, most of us, and I've been to doctors. When I lived in Columbus, Ohio, there was this doctor who worked, just had, just a general practitioner in a bad neighborhood, but just worked all by himself, took nothing but cash.
And that person did better.
But you could see that doctor for probably $30. I mean, he even answered his own phone,
Right. Right.
And not another thing too was he had a phone out of the 1940s. But anyway, I mean, it was old. It was black, rotary. But anyway, it's very interesting though when you introduce all this stuff, and it just makes things more complicated because, I would love to look up, say health that, I bet a hospital 80, look at all the people in the healthcare industry who just push papers and go to meetings.
But in many parts of the country, physicians have, if you're not working for a large organization, they have stopped accepting insurance, right? So they will call it a concierge service if you want, but sometimes it's more of a cash, paper service. And in most of those places, the physicians that I know that went that route are actually much happier individuals. Yes. because what would happen is you would submit your claims out to a clearinghouse, and you would make, you'd make a fraction of what it is that you would bill, because there's so much money that would have to go to administrative, third party type issue. And so the persons that I know that were able to do that, and so for me it's slightly different because I operate. Most people, you consider it catastrophic if you want. Most time if somebody's going to surgery, I have to accept insurance because I'm having to deal with the hospital. Hospitals having to actually say these are the rates. Now, I don't have to. Sure, I can say no, I'm not going to do this. And if you want to see me, it's all going to be cash. But most people don't have, a bundle of cash for surgery. If you're dealing with snotty noses and just the usual, hey, your blood pressure's high, etc., it makes more than complete sense to do something like that. Absolutely, it just depends on the specialty, right? You're not going to go into say a urologist or neurosurgeon's office and say, hey, look, I need brain surgery, and by the way, here's $100,000 for my stay in the ICU, what have you, right? That's just it depends on what it is, what type of medicine you practice, also. But to answer your question, or to agree with you, yes, if you're doing stuff that does not require a hospital stay and significant expenditure and the risk associated, then something like that makes more than complete sense.
Yeah, another thing I wanted to bring up, when the coronavirus stuff started, there were a lot of more rural hospitals who weren't allowed to do elective surgeries, and they were actually losing money.
We had to stop. They wouldn't let us do electives. I mean, they didn't. It wasn't just rural; it was main hospitals too.
Yeah,
but because they didn't, and it has to do with risk associated with the type of procedure. Because if you're going to have someone that potentially has a complication that needs an ICU bed, they didn't have the ICU beds available, right? So that's that's 100% true, even at our hospital, which is a pretty big facility.
But one theory I've had on this whole thing was, it seems like to me maybe they were trying to consolidate the hospital industry.
In this particular well, I could speak for here. We didn't have the beds. I mean, so if you were going to have someone that needed an ICU, you didn't have the staff, because they were already taking care of someone who was dealing with consequences of a respiratory infection and whatever else. I mean, because people were still having medical problems regardless of the fact that they had COVID pandemic, right? So naturally you have X number of persons that are going to be using these beds and facilities on any given day, compounding this with the respiratory illness that took over. So when our hospital was knocking out or saying, listen, we cannot do elective procedures, it was based upon availability of means to take care of these people.
Well, what I mean was, by consolidating the hospital industry. I mean, if you go back 50 years ago, every hospital was just kind of its own organization. It was one hospital by itself. And now hospitals are all part of these big
Oh, they do, these big
conglomerates of
conglomerates.
hospitals.
Oh,
And you know,
absolutely,
it's
they
like,
do.
and I think maybe it was like, you know, we'll go buy up some of these hospitals that lose business. You know, not to mention, you know, another thing we didn't, you know, comment on, Charles, you know, was people missing mammograms and people missing cancer screenings and stuff like that. And
Absolutely.
I've heard
Yeah.
stories about that, and that's another thing that I think is just absolutely devastating here.
But it was not only because they, you know, some of these services were curtailed. It was also the number of people that were scared to come out to actually. I mean, we would, when a lot of the stuff began to slow down and people were willing to actually come in, you would find cancers that I mean, whether it's cancer or some other ailment, things that were highly treatable become now very difficult to treat as a consequence of the delay in care. You're 100% correct. But it wasn't simply the hospitals; it was also the patients. I mean, to this day, there's still patients that don't want to necessarily come in as a consequence of being afraid to be around other people. As crazy as that may sound, it still happens, right? So they created this thing during the pandemic of telehealth, right? Prior to this time, you didn't have Zoom that you can talk and etc., right? And I am vehemently opposed to this because unless you're just refilling a med or what have you, in which case I just do it on the telephone anyway. I don't need to talk to anybody like a Zoom call and document it. I just, yeah, sure, send it in. But I mean, in order to properly treat most people, you need to see them and touch them. And I mean, in the realm of medicine, I mean, if you're dealing with psychiatry and stuff, maybe perhaps Zoom, but I'm a firm proponent of actually physically being with someone to get an overall gestalt as to how he or she is doing, right? You don't have that on a Zoom call,
Yeah.
right?
Yeah, I suppose as a, you know, when you've been a doctor long enough, you start to see these little cues and, you know, these little things that you may not see, obviously, you know, like when my dad got older, his doctor, every time he'd go to his doctor would always say, I want to look at your feet just to see how
Right,
to see if your feet are healthy or not.
right.
You know, and I suppose I suppose if you've been a doctor long enough, you probably can read these little signals that, you know, like
And
how people,
in
yeah,
some of
that
these,
you might not catch these things on Zoom.
right. And I mean, a lot of these things are, you know, you don't even sometimes, it's hard to put into words exactly what it is, but there's some trigger that when you do this and you do this and you do this, it just sort of, it triggers something in your head to look in a certain direction, right?
Yeah.
And you don't get that from a telemedicine visit. It just I'm not a fan of telemedicine. I don't think it's good. I mean, for certain very curt, short, easy things, sure, but to truly take care of someone, I'm not a proponent at all.
Yeah. Yeah, I mean, you know, the other thing too is it might be the best thing available, you know, if you've got somebody who's in a really super remote location too. But
Yeah.
you know,
I mean, yeah. If you're out in out, you know, in 80 miles away, and you don't have the means to put gasoline in the car, and you need a refill, and the pharmacy's down the street, and it's something simple, then sure. But if you truly have an ailment, I believe in touching somebody, seeing them, you
you
know,
know,
getting them.
we've talked a lot about healthcare, Charles, but I should ask you some other questions. Have you run for office before, and have you held an office before?
Politically, no. You know, socially, yes. I mean, you're talking like, you know, class presidents or whatever, right? Vice
Okay,
presidents
yeah.
and that sort of stuff.
I mean regular. I mean a regular
No,
adult
no,
election.
no.
Okay.
I've grown up around politics. My father's a local district attorney. We've helped with a number of races over the years. You know, just friends that run for whether it's Congress or you know you name it, right? Uh, I've helped in that capacity. When I say help, I'm not knocking doors or what have you. You know, but you know, you write letters. This is who I'd recommend, etc. But no, I've not run for office. I've never considered myself a politician, and for the most part, I like to be sort of a quiet, just get my work done kind of individual. You know, I leave you alone, you leave me alone, and that's kind of always what I've been. I've always been taught, don't toot your own horn. This is a weird circumstance for me because I've always been sort of taught, don't go out and sort of preach to other people. You know, everybody has their opinions. Don't you know? I'm not one to sort of toot my own sort of horn or try to tell you why I'm necessarily better than the rest. but I think I've been compelled to do this in this year, in this manner, because I think more people need to get involved in our political process. I truly do. I think the problem with this country is that persons have become so accustomed to let someone else do a job for them, yet at the same time people can complain. I think this needs to change if we want to make this society back to what it once was. I think right now the fact that you have voter apathy to the degree that it is abhorrent. I mean, it's horrid. You have 60% people are going to show up for a presidential election, 50% for gubernatorial. On the down ballots, you have like 20% voter show up. Right? It's horrible. So
Yeah.
so when I got into this, it wasn't. Look, I'm not like some crazy person going through a midlife crisis. I'm an American that's just pissed right now that currently our society seems to be going down the wrong path. I don't want to see my kids grow up in a place where now we're getting 34, probably $35 trillion in debt. I mean, how much
Yeah.
more can we push this before the dollar is useless,
Yeah.
worthless, right?
Yeah.
I think normal Americans need to get, regardless of whether or not they're going to be the focus of ridicule or the focus of, call it investigation, who is this person, etc. People need to stop complaining and start doing. Okay. And I have the means to do this. I mean, I'm a fairly educated individual. There are many people who could probably do this job far better than myself. But where the hell are they? Why are they not running for office? Right? Why is it so difficult for a common person that has somewhat of a decent uh, education, that has a conscience, that sees the North Star where this country should be headed, which most people can agree with. I'm not saying going on some limb. I'm not always right, but why is it that it's so difficult for people to interject themselves into this particular arena? I think it's needed. I think people need to start doing and stop complaining. Um, I'm a doer, not a sit on your ass, not do much. I like to accomplish things. And so that's why I kind of got into this. I know this is insane, right? A simple doctor from New Orleans running for, the highest office in the world, right?
Yeah.
Uh, but at the same time, look at our two choices that we may have this fall. Really,
Yeah.
really. I mean, really. I mean, and how's it going to make this country change and better? It's not. You're going to have two persons, one who's going to want to take out the wrath after everything that he's been through recently, the other who probably doesn't know where he is. And you're going to have, these are our two choices, and this is the best country, the greatest country on earth, purportedly, right?
Maybe you don't have to answer this if you don't want to, and maybe I shouldn't ask this, but what do you think are the chances of either one of them having a major medical event before the election?
I doubt it. I would be curious to see. I'd be curious to see how long they can continue down a difficult road.
Or having a major medical event if they're elected president?
And but that could happen to anyone, though.
Okay, yeah,
That's the
maybe.
thing. But you have a higher chance as you get older. I'll agree to that. But I mean, so the simple traveling around that. So I've been, most of the persons that are running for office on the Libertarian ticket are traveling around this country, right? And you see city after city to the point where you're like, where was I last weekend? I don't know. I mean, you do if you think about it, sure, but you begin to see hotels and ballrooms and hotels and ballrooms, etc. That is a tough thing for someone who is that aged. I mean, now mind you, there's a tremendous support staff, etc., but it still takes the toll on someone's body. So I'd be kind of curious to see if they have to campaign, how those particular individuals fare, physically, right? That'd be interesting to see. Mind you, that they have far better support staff than any of the persons that I know that are running for office. But you're right. I mean, it takes its toll on the body. It's not as simple as just hopping in the car, driving down the street, and giving a talk. It'll be interesting to see. I hope. As a physician, I truly hope nothing happens to either one of those individuals. Obviously, um, but at that age, yeah. I mean, the other thing is like, so why are these the best two people in this country to run for office? Really? I mean, really? Is this the best America can do? I mean, come on. Uh, it, it- you know, uh, Everyone has opinions. Everyone should have opinions. We all should have the right to speak. Um, I find it very difficult to believe that this is the best two individuals that this country can put up on those two tickets, right?
I certainly don't think they are. That's why I wouldn't be voting Libertarian. But incidentally, you mentioned kids. How old are your kids?
So we're a split family, but we have uh, my two stepchildren, 35 and 30, and my children,
Okay.
21 and 18. Right. So
Okay. So
yeah.
yeah, you can't really tell how old you are, so it can't really just a guess as how old your kids are. So do your kids have? Are you a grandfather yet, or?
Yes, the oldest had a child who's will be one. Yeah. He lives in Austin. He lives in your neck of the wood.
Yeah.
Yeah.
I'm curious when you're. I bet your kids are always when they have a baby, they're probably asking for medical advice all the time, aren't they? And of course,
Sometimes.
being dad, you can't really say no. But
Yeah, but
anyway.
I tell them the same thing I tell everybody. Listen, look, I'll tell you what I think, but you need to see someone so they can lay hands and actually make a diagnosis. The last thing you want to do is sort of like, this is what I think, and they take that and as this is what is actually going on, only to find that there's another ailment that needs to be corrected, right? So, same holds true. It doesn't matter family member or not. Yeah, I've seen too often persons, oh, yeah, just take this and you'll be fine, and they're completely wrong, and something actually more serious occurs. So, so I tell them the same thing. You need to see a doctor if they don't live close, right? If they're here, of course, we
Yes.
take care of them.
Yep. Since you're from Louisiana, what do you think about Huey Long?
I haven't read a whole lot about Huey Long. I did back in the day because everyone has to learn about Huey Long when you go through
I
school,
mean, he's
sure.
probably the most famous politician to come out of Louisiana, right?
Yeah, maybe, but we have some other sort of smaller politics that down here that may be, it, from a national level, yes. From a local level, that is probably a little bit questionable. He was a bit of a tyrant, from what I gather,
Yeah.
right?
He was governor of Louisiana in the 30s
Yeah,
during
yeah, yeah,
during
yeah. No, I know, no, I know exactly who he was, who he was, and etc.
yeah.
They
Well,
had,
that's for the listeners too. Yeah.
but Louisiana has its own fiefdoms, or did, not any longer really. But back in the days, they had their own set of fiefdoms in various parts. We don't have counties, we have parishes, and there some of these can be pretty controversial when it comes to oil and gas and lands, etc. And yeah, so Huey may be the largest known outside of the state of Louisiana, but we have our own set of smaller fiefdoms that to this day continued to play a role in politics, right?
Oh, he got assassinated. That might have been part of what makes you a
Thank
legend
you.
too when you get shot like
That's
that at 42.
that's yep, and you can see that bullet marks. I think they may still have them in the state capitol.
Oh wow.
Yeah, John Goodman did a show, the Huey Long thing. I was just out of college and worked on that show, so I remember the assassination scene in the state capitol.
Yeah, it's very interesting. Any other key figures from New Orleans or Louisiana history we should know about, or?
Well, we have quite a few politicians probably that went to jail.
Unfortunately, it seems to be that way. Yes.
Yeah, we do have some notorious or infamous politicians, so to speak. Yes.
Yeah, yeah, I'm trying to think of some other people we might have had. Louisiana's got a colorful history too. Also with the Civil War and stuff like that. Being the Edwin Edwards and some of these other awful people.
Oh yeah.
Oh, Carville too. Oh, geez. Hey,
Oh
you
yeah.
got to tell us something about Carville.
I don't know. I don't know, James.
Yeah.
He has a house around me somewhere around there, but I don't know him. I mean, I think I've met him once, but it was in passing. Yeah, he used to be on the air quite a lot.
Yeah, he's got a presence, which kind of he's one of those guys you kind of pay. Yeah, he walks in a room, you kind of pay attention to him just because.
We
Just
know
kind of
that he and his wife, right? They're both They're both very political, right?
Well, she was on the other side's what's really
That's right.
wild, which tells me how much difference there really is. It's a
Yeah.
yeah, but yeah, that certainly makes Louisiana. There's a lot of colorful things out of Louisiana. I've only been through it though, but I maybe need to get there and see more of it. I know they love their football there, and
Right.
that's another more positive statistic. I think Louisiana has more Division I college football players per capita than any other state. So you got some good football there.
Right. Go Tigers, right?
Yeah, go GEAUX. Go
That's
Tigers.
right.
Yeah, spell it.
I wouldn't know the other spelling, so
Yeah, it's a. Yeah, it's a. Yeah, what should I visit if I go to New Orleans? Definitely
well,
visit.
well,
I
you
want to
gotta,
see. I want to see Fats Domino's house. I've heard about that, but yeah,
I mean, there's a lot to do. I mean, it's French Quarter. You want to come during a festival so that you can actually enjoy. Uh, my favorite festival is actually Jazz Fest, which is always this
yeah,
last weekend of April and the first weekend of May. And there's it's generally like a Friday, Saturday, Sunday, Thursday, Friday, Saturday, Sunday. This year, I think it's Thursday, Friday, Saturday, Sunday, Thursday, Friday, Saturday.
yeah.
And then during that second week, many of the musicians may play around town, or you'll have, if they didn't play at the Jazz Festival, actually there'll be other musicians that play around New Orleans. So if I were going to come to New Orleans to see it and experience a cultural event, I would come to the Jazz Fest. It's out at the Fairgrounds racetrack. It is a just a horse track out here, but they convert the sort of center area into a multitude of stages and food booths and arts and crafts, etc. And it's really people from all over the world that'll come in to see this, and it really is quite a fun event. And it's generally around that time. The weather is generally somewhat decent. You can sort of experience many of the foods that New Orleans has to offer in one small area, while at the same time you can listen to really good jazz, gospel, blues, and then obviously much bigger. I think the Stones are playing this year, but that, I mean, there's some big names that come too. But I generally like to hang out in the blues and the jazz tent.
That's where our rock and roll eventually came from. It's
Right. That's
truly
right.
remarkable, and look at all the people who were around the area, the Delta Blues,
Yeah.
or even made it up to Memphis like Elvis. It's really remarkable. I always.
Yep.
When I think about Louisiana music, I always think of two songs: Amos Moses by Jerry Reed and Poke Salad Annie by Tony Joe White.
That's funny. That is pretty funny.
Yeah, and well, Amos Moses is explicitly about Louisiana, but
Right.
Poke Salad Annie. Well, I shouldn't say it, but he's the white guy who sounds like he's black.
Right.
Yeah,
No, they have good
yeah,
musicians. Last night we were just at one with George Porter playing.
yeah.
One of the meters, the old funky meters, right? Fantastic.
Yeah, I don't know if there's any other music I need to know about, but I don't know it as well as I used to. But of course, Elvis came out of Mississippi. Elvis actually would sing "Poke Salad Annie" a lot in his concerts. Apparently, he liked that song. Yeah, yeah. Louis Armstrong, Fats Domino, of course. Also, Fats had that. Had his song "I'm Walking to New Orleans." Yeah.
Right. Yep. No, absolutely. He used to play all over. I did not know him, but my parents actually saw him quite a few times. Um,
Yeah, it's definitely got a lot of unique culture there. I suppose too, I could see some maybe monuments to the Battle of New Orleans or monuments to the Civil War too, because they both played a key part there. Of course, the
yeah,
Battle
and
of
if you
New
go
Orleans happened after the treaty was already signed.
right, but and you could go down. Well, we call it down the road, but if you go south, there's like Fort Jackson, which is one
Yeah,
of the forts that used to guard the river. Across the river, they used to have Fort St. Philip, which has fallen to disrepair and it's for the most part washed away. But but there are a number of sort of sites like that heritage sites that you'd probably find extraordinarily interesting. Not to mention up and down the the river, there's various plantation homes, etc., which are stark reminder of what once was, but nonetheless beautiful to see. Um, uh, there's a good to do. Just you want to time it when it's actually conducive to actually seeing things as opposed to sweating.
Yeah, I know what you mean. I can see. Yeah, I can imagine it's that way. It's my parents visited New Orleans years ago, but I've never been there. So, for any politicians out there that you admire in particular?
No, I guess the whole libertarian thing should be the person's Amash and um, that were part of the Libertarian Party. I guess he's running right now as a Republican, right?
Yeah,
And everybody would say Ron Paul, etc. I like politicians that speak, that actually do what it is that he or she says they're going to do, and regardless of what ideology. I mean, obviously, I am libertarian and I believe in small government, but I like persons that don't waver based upon uh, the political climate, so to speak. I mean, you have to be someone who will adjust one's opinions in order to get along with everyone to come to a common solution. I completely agree. But I don't want someone to get into office that's going to say one thing and do the intact and opposite if given the opportunity to do what it is that he or she initially purported to do, right? I value, and I forget what what president it was. Person who gets into office, does the job, and quietly sort of goes home, and quietly kind of goes home. As let me turn this off. I like persons that do their job and don't need a lot of attention for doing their job. You know, uh, Someone who's not, jumping to try to find a camera. Although sometimes in this day and age, I guess you need to in order to get your message across. But I like the quiet person that does the job and works, and then does the job,
yeah,
and then doesn't expect a lot of things after, like doesn't need the limelight thereafter in order to that those are the people that I would sort of espouse, like to be, or would like to emulate, so to speak, right?
yeah. Do you consider Anthony Fauci and Deborah Birx villains?
So I hate to use the word villain. I mean, the guy's obviously a hell of a lot smarter than I am when it comes to immunology, and I'm not an immunologist. I wish it would not have happened the way it happened, right? Uh, Villain, you'd have to dig and say, all right, so what was this guy's modus operandi for doing what it is that he did? If you're given the highest position in the land to be a physician telling other physicians what to do, it's hard to put yourself into that situation. It's easy to do it as a Monday morning quarterback and say, "Oh yes, he's horrible." These are the things that happened. At the same time, I'd like to know what it is that he or she knew prior to the arrival of that particular virus on the American shores, right? And I don't think that any one of us has actually received any information, and maybe we never will. Maybe we will. I don't know. Do I agree with the way things were handled? No, I don't. I do believe in taking care of people and trying to save as many lives as possible, regardless of what I think. However, I you only have so much information. I only have so much information to act upon, and when that came down to us, we were acting on the best information available. Do I think government liberties were overstepped? Of course, right? I don't think that's even anything that people can, in this day and age now, looking back, can actually say, could disagree with. I mean, even individuals that were all for it might said that this was carried out for too far. Sure, and hopefully we never ever see that again. I hate to use the word villain because then that becomes everything I don't want to be, which is actually a vitriolic person that just, espouses hate speech. I would say, listen, I'd like to rectify the situation and find a way to correct these measures so that this never happens to us again. I think you get more accomplished by trying to sit down with someone and saying, listen, this is screwed up. How do we make it better? And let's move forward, as opposed to dwelling on things that happened in the past. Now, you do need to dwell. Around New Orleans, people a few years ago came take down all these monuments, Civil War type figures, right? And I can understand why no one wants to sit there and pay homage to someone that purported had slaves, etc. But at the same time, you need to be reminded of things in the past so that you don't recreate history, right? These things should be brought to our attention so that we don't do this or make the same mistakes that we once did. Uh, you know, uh, History always repeats itself, and people need to realize that. I mean, just read a history book and go back and read what's happening now, and you'll say, "Wow, this is happening all over again." I believe that history, you need to take note of what happened and continue to remind yourself of what did happen in the past so that you don't make the same mistakes that our forefathers had made. And so, so to use hate speech, I don't agree with it. To say that we want to make sure that this doesn't happen again and the government doesn't intrude to the degree that they did, I agree. You know,
Yes, and we're talking about this just as I can't post in Facebook groups for a week. But anyway, yeah, that's very interesting. Yes, I'm trying to think if there's anything else left to ask you. What'll if you're elected president, what'll be your first day, your first week in office be like?
very hectic. No, it would. I mean, so look, first of all, you have to gather a team that you trust and that have the same values, but also a team. You can have all the values you want. These need to be people that are willing to act and can act decisively, and that actually will carry out what it is that we need to accomplish to make this a better country, right? So, in many of the times or cases, some of these persons may not align with 100% libertarian values, but they can accomplish libertarian goals, right? So, how is it that we're going to? I hear people say I'm gonna crush this, I'm gonna crush that, I'm gonna take this branch of government away, I'm gonna take this branch of government down. To which I say, well, that sounds real nice, but unilaterally you can't do that. I mean, that's going to require a majority of Congress. And yes, you could push in that direction, but you're not going to unilaterally do this. Otherwise, you're the tyrant that you're trying to fight, right? So you have to be able to get along with people, right? So I think that first week would be exceedingly difficult to align yourself with everyone and say, listen, I think libertarians have a huge chance this fall. And the reason why is because this country needs an adult in the room, right? You have spending that's out of control. You have a two-party system that seems to be working now as a one-party system. Look at the bill that passed yesterday, the House, right? $1.2 trillion, right? In many cases, people say that the Republicans sold out. But yet, basically, you have a country that's a spendthrift right now. Yet there's so much vehement rhetoric. The two-party system can't purportedly get along. Although I guess you can argue that based upon the way people vote.
Yeah,
You
I
know,
I guess I didn't word that question very well. What will you do in your first day and first week?
the first thing I think the biggest problem I see for this country right now is the debt, right? That is the single biggest problem. And as soon as you can solve that, many of the woes that we have are going to fall into place, right? So you don't have the money for many of these services that, people say, we need to cut this service. Well, sure you do. Guess what? If you didn't have the money, it wouldn't happen, right? So I think you need to get all the government. I'm a firm believer in there should be less central authority. The federal government has gotten way too powerful, right? Like Jeffersonianism, right? It should actually many of these laws, many of these decrees, etc., should fall back upon the states, right? Because that way, as a local level and a state level, people can control their government better, right? I'm not a big fan of large government, but I'm especially not a big fan of large central government or federal government. And so I think you say, listen, governors, you are the people that have more power in this country, or you should, as opposed to the federal government. And consequent to this, we need your help in trying to rein in the reckless spending that's driving this country in the wrong direction. And I think by doing so, many of these woes that people are mad about will correct themselves. They'll have to correct themselves. You won't have the dollars to do it.
Yeah, indeed. What about bringing the troops home, pardoning
Well,
Edward Snowden,
absolutely.
Julian Assange, Ross
Yeah, I mean
Ulbricht,
that.
Leonard
Well, yeah,
Peltier,
you can't. Yeah, I mean, well, so
non-violent
someone.
drug offenders?
Exactly. I mean, so if there's no victim, right? What I mean, that's the thing, victimless crime. Many of these things need to be addressed. Yes. Okay. Yes to all of the above. It is a travesty, for instance, right now that you have the number of persons that we do incarcerated in the United States. Okay. Uh, if they're nonviolent. I mean, if you're killing someone and hurting someone, then that's a whole nother ballgame. But for nonviolent crimes to put someone in jail just seems a little bit uh, silly. Not a little bit, a lot silly, right? I mean, people can get better, but once they get thrown into a system where there's no end in sight and their lives are now destroyed as a consequence. I mean, try to get a job after coming out of, out of jail for selling weed, right? Uh, it's tough. I mean, you can't. What were you in jail for? I was in jail for, whatever, selling weed. And then suddenly you're going to try to apply to med school or law school or what have you. Good luck on that one, right? It destroys people's lives, and it doesn't need to be that way, right? Um, this is not, this is not me purporting though to have an uncivil society. Of course not. Uh, I think that is entirely not the case. I think you would be more civil should you afford people the opportunity to correct their wrongs, right? And if it's a nonviolent case, so to speak.
Yeah. Yeah. So, what did you think of the vaccine mandates and all that stuff?
I didn't like them. I didn't like them when it first rolled out. When it first rolled out, I understand why people were trying to push this to move that curve, but at the same time, it's your body, do what you want. I mean, that's this. We have this thing in Louisiana where I have to take a flu shot on an annual basis in order to see patients. Otherwise, you have to mask, and I'm not a fan of it because I know the flu is not going to kill me, and I see the flu when it hits. I see it every day of the week, many times, right? I don't necessarily need a flu vaccine. I mean, I know that. I mean, I've been doing this, for long enough to realize that. And maybe at some point you will have a, horrible flu. Um, but until that time comes, I'm not necessarily a big fan of that. I understand why it happened but I don't think the government should be able to tell you how one should uh, use their body. I just don't. I mean, because at what point do you stop? So where does this end? I mean, I mean, are we going to start mandating that everyone has to do an HPV vaccine? Do you have to do it for Haemophilus? Do you have to do it for Streptococcus? Do you have to do like where do you draw that line, so to speak, right? Um, Once again, this is one of those things going back to the whole Fauci thing. You learn from past mistakes and you try to move the pendulum back into the right direction, right? So that everyone, and if anyone ever questions this, you can go back to saying, look, this is what happened during this particular time in American history, and this is why we don't want to do what it is that you're purporting that we do, right? We learn from mistakes, and we try to correct these mistakes, as opposed to ignoring them and say it didn't happen and let's move on and just recreate the same problem all over again.
Yes. Yeah. Well, it's been a pretty good talk, Charles. Do you have anything else to say before we go here?
No, I mean, well, I'd like to say thank you very much. For the listeners, if you would look at the website and give
Yes.
your feedback, I would appreciate it. Our website is www.ballay2024.com. You can find us on Facebook, on Twitter, or X, on Instagram, and I guess accordingly, we should be on other platforms in the very near future, or so I've been told. But if anybody has any questions directly, you can also
Yes.
email me at charles@ballay2024.com.
Yes. And that's BALLAY2024.com. Yes.
That's
Yeah,
correct.
so that's
Chris,
that's where you can find Charles. He's one of many candidates. I think I've got what, 7 or 8 candidates on right now so far. It seems like we got a lot running, but anyway, else.
Right. Well, thank you, Chris.
Maybe I'll see you at the Texas convention in a few weeks.
Probably so. Probably so. Yes, sir.
Yeah, we had an interesting format with that debate. I don't know why, but it was a fundraiser, so that was one good thing.
Yeah,
but
they raised a good.
You ended up 5th in that though, so you didn't get in, unfortunately. But
yeah, that's unfortunate, but that's okay. I will.
Yeah, but the second most populous state, it's hard to ignore Texas.
Right.
Who knows? I think Tennessee is also on that weekend. It's you'll usually, that's one thing about this year. You'll usually find a couple conventions going on at once. But
right. Yeah, it's busy. It's a busy time of the year.
Yeah. I know that Tennessee is out in Kingsport. You probably got a shorter drive coming to Texas because Kingsport is way east in Tennessee. But
okay.
Anyway.
Well, thank you.
But anyway, so maybe I'll see you then. Yeah. So
yes.
Please like the video, subscribe to the channel. Go buy my novel, Escape from the Village. Check out my Substack. Thank you, Charles Ballay. I'm Chris Baker, and we're out.